Good day, listeners, and welcome to another episode of Dr. Anyoha's podcast. Today, in this podcast, I'm going to talk about bronchiolitis. Bronchiolitis in infants and children. That's what we're going to talk about today. Now, the reason why I want to talk about this today is because in the course of 3 weeks, I've seen 2 infants with bronchiolitis. I'm practicing in the United States, and it's getting cold. This is November 25th in United States. So it's pretty cold, and that is when bronchiolitis comes up frequently in the United States. In areas of the world that is tropical, it usually comes up in during the rainy seasons. But it's good for parents to know about bronchiolitis. So let's dive into that quickly. The first baby I saw this month, actually, with bronchiolitis was when I was in a hospital where I practice New York, and I was called to see a baby, this baby for difficulty in breathing, cold and cough, and I was called by the emergency room adult physicians to help them figure out what's wrong with the baby. So my diagnosis, which ended up to be right on the money, was that the baby, barely 1 month old, has bronchiolitis. The baby was coughing sporadically and frequently and having short of breath. You could see that the baby was fighting breathing. He was irritable. That's what babies do when they are uncomfortable. He had some runny nose, some mucus in the nostril, and he was kind of slightly warm, not big time, probably 101 degree Fahrenheit. So my diagnosis then, presumptive diagnosis before labs were sent, that this baby has bronchiolitis, and given which turns out to be true, as a matter of fact. So when viral panels were sent, the kid had RSV bronchiolitis. So that was right on the money, and it shows definitely most pediatricians are able to diagnose bronchiolitis clinically based on the season of the year, the symptoms the baby has, which is mostly cough, runny nose, fighting for breath, irritability, and sometimes fever. So it's not a very big deal to make a diagnosis. Now, what is a big deal is to figure out whether this kid has to be in a hospital or whether I need to send a kid home. That was a big deal. We have to really be an experienced physician to make that call. So, given my experience in that scenario, I made a call that the baby has to be admitted in a hospital, to ride out the bronchiolitis, because it's a viral infection usually caused by what we call RSV virus, a respiratory syncytial virus. But other viruses can cause bronchiolitis, including rhinoviruses, adenoviruses. A whole bunch of viruses can cause bronchiolitis. Parents to realize that. So this baby was admitted, right? And just to watch the baby, because little babies, when they're that young, like less than a month old, they could go down quickly, suffer respiratory issues, respiratory failure. They can actually have difficulty in breathing and turn blue. In fact, I tell my students, my medical students and PA students that come to my office, long time ago when I was doing a locum in somewhere in one of my consults, I saw a baby who had bronchiolitis, and by the time we we could admit him to the floor. The baby, the infant, probably about 6-7 months old, turned blue and kind of stopped breathing. And we had to call code to kind of resuscitate, give him some respiratory support before we send him to the floor for admission. So bronchiolitis could be very catastrophic. It's not something to be taken lightly. So the two babies, the other two babies I saw within 2 weeks, I had to manage as an outpatient. In other words, the baby's a little bit older. I think he was about 4 months old, and he's difficult in breathing. His respiratory rates and chest movement wasn't that severe, right? And the baby was, even though the baby was wheezing, but he was smiling too. So that was a mild bronchiolitis. So what I did was I had to tell the parents to watch him, suction his nostrils and bring him to my office every other day so that I could watch the baby and make sure everything is good. So, but the other baby who is actually the third baby, who is actually almost the same age, 3 months, with the baby I just talked about, wasn't doing very well, right? That baby was gasping for air, right? Each time the parents brought him to my office, the baby was gasping for air. So I had to send this baby multiple times to the ER for hoping that they would keep the baby in the hospital. So the baby ended up being in the hospital to ride over some severe symptoms of bronchiolitis. The reason why babies go to hospital when they have difficulty in breathing due to bronchiolitis is for the oxygen to be continuously monitored, and when it is low, for them to have supplemental oxygen, right? And of course, to look for some other things that can make a baby that sick. Just because your baby is coughing, runny nose, wheezing doesn't make that bronchiolitis. You still have to seek out the consult of a clinician to help make that diagnosis. So bronchiolitis, what it does in essence is it usually starts as a cold. A baby who has a cold, a runny nose, stuffy nose, for a couple of days, and then suddenly they start coughing. They start coughing, and the cough becomes worse. And when the cough becomes worse, they cough more often. They can have these episodic bouts of cough that last for 10 seconds, 15 seconds, and which is too stressful. And they can have fever. Now, part of the problem is because the viruses that cause bronchiolitis will find their way from the nostrils to the lungs, to the small bronchioles, part of the lung tissue. They settle there and they cause inflammation. They cause inflammation and damage to the small pathways in the lungs, and that causes this air hunger. And the babies usually breathe very fast. If you look at their chest, is going in and out, and they're rapidly breathing. And then when the doctors listen to their chest, they hear this wheezing sound that could be very severe, which signals that the child or the infant is having problem with moving air in and out of the lungs. So that could be dangerous. And parents usually bring these babies at this time when they've tried, sometimes they've tried over-the-counter medications and nothing works. And of course, a baby who is having difficulty in breathing is not eating, because you have to You have to, get in air first before you can eat. Getting in air is more important than feeding. So usually these babies don't like to feed because they're fighting for their breath. So when we see them, we examine them, listen to the lungs, see if the severity of the bronchiolitis, how the baby is moving air. Is he wheezing all over the lungs, part of the lungs? Is the wheezing mild, moderate, or severe? Is the baby gasping for air, coughing for a long time that they become blue or purple or change color? Are they eating? All right. Are they eating, drinking? So these are the things the pediatricians take into consideration before they make a judgment on whether to send the baby to the hospital emergency room to be admitted through the emergency room, or to tell the parents to bring the baby back the next day to be examined. Bronchiolitis is caused by a viral infection. There's no magic bullet treatment, right? Because most viruses don't respond to antibiotics, and antiviral medication is not commonly used. Because this is supposed to be an illness that does not last for a long time, right? So most times, within a week, the child is better, right? And unless the child or the infant runs into trouble, but within the week, the child is supposed to be better, or mostly improved with bronchiolitis. So monitoring this child, striking a balance whether the child needs to be managed at home by the mother or go to the hospital for admission is very, very important. And the pediatrician helps the parents make that decision, because a kid who's not drinking, who's not eating, can be dehydrated, right? And that could compound the problems of bronchiolitis. So, and of course, if this lasts for a longer time, there could be complications as well. Baby could develop pneumonia, baby could develop ear infection, baby could stop breathing. So there are potential complications with bronchiolitis. And I want my listeners to be aware of that. It doesn't matter the age. It could be one week old baby, 2 weeks old baby, 3 weeks old baby, especially if they're exposed to older siblings, older toddlers who go to daycare and bring some of these viruses home. These viruses can transmit it to the baby who doesn't even go anywhere. And that could be how the babies get bronchiolitis to start with. All of the parents who go to work and who work in the hospitals or in daycares, they can bring these viruses home as well and transmit to the babies through respiratory droplets. So now you know what to watch or how to begin to suspect when your baby has this RSV bronchiolitis, which is going to get worse. This is just the beginning of the cold season in the United States. And we expect more of this to come up as the winter rolls in. This is going to be worse in December, January, and February. And of course, these bronchiolitis issues could be confounded by the COVID virus problem too. So when an infant goes to the hospital to be assessed for bronchiolitis, and not only will the doctors do tests for viruses that cause bronchiolitis, like RSV, flu viruses, adenoviruses, they also check for COVID viruses, right? Because this could compound the problem. Nothing prevents a baby who has RSV from also having COVID virus. And that could be a double whammy effect on the baby. Babies are very fragile. Whenever they're coughing, they're uncomfortable, they're not breathing well, you see their chest going in and out, and they're not eating, drinking, or they have fever, you really need to consult with your pediatrician to see what's going on with your baby and see if this is bronchiolitis and if there's anything the pediatrician could advise or suggest on how to stop that. Sometimes in my office, I like to try the albuterol pump. I'd like to try that and see if that has some effects on the wheezing. Sometimes the parents come and tell me it helped a little bit. I could be because as the day goes on, the virus is getting out of the system. But some parents, report some success with albuterol, and I don't have any problem trying that in a baby who is moderately wheezing, who's happy, and whose parents want to give it a trial. Most important thing is to people around the baby should make sure that washing their hands, maintaining a nasal hygiene. Don't sneeze on the baby, don't cough on the baby. Wash your hands frequently, and of course, get your flu vaccines. If you're protected against flu, chance is that you would not pass it to the baby. So get a flu shot, get a COVID vaccine if you need to, because that could also help with exposing your baby to bronchiolitis. But if that happens, now you know that there are occasions when babies could be admitted because of bronchiolitis to support their oxygen level, to support their body to fight against the infection until it goes away from the system. Thank you so much for listening. This is Dr. Anyoha. I'm a pediatrician, and also I have a doctorate in infant mental health and early childhood development. Thank you so much. Bye.